A very good morning to Dr. Daphne Anthonysamy, Consultant Breast and Endocrine Surgeon, Dr. Fatt, Consultant Obstetrician and Gynaecologist. Ladies and gentlemen, thank you for joining us for today's Starlive event. I'm Denise from Star Media Group and I will be your host for today. Ladies and gentlemen, before we begin, allow me to share with you what Starlive is all about. As a way of connecting with you, our readers, Star Media Group presents an exciting array of talk sessions covering various topical matters of interest, from guides to leading a healthier lifestyle to meet and greet sessions with personalities. Our guest speakers for today's Starlive session are Dr. Daphne and Dr. Lee from Subang Jaya Medical Center. In conjunction with the Breast Cancer Awareness Month, our guest speakers will be sharing everything you need to know about menstruation and breast cancer. Learning to recognize irregular changes will save your life. Ladies and gentlemen, before we begin with the talk, just a few housekeeping rules. Please switch your phones to silent mode. Please reserve any questions that you may have for the Q&A session after the talk. And now, without further ado, let's welcome Dr. Lee to the stage to shed light on the impact of menstruation on women's health. Dr. Lee.
Thank you, Denise, and thank you for coming. First of all, I would like to thank the Star and Subang Jaya Medical Center for giving me this opportunity to talk to you about menstruation. I didn't realize that I'm going to get so much publicity, a full page advertisement. One of my friends called me up, hey, did you get a Tansri? I know, because that page actually deserves a Tansri title. Anyway, in fact, I was surprised that they actually publicize it so much because it's a taboo topic, So, nobody talk about menstruation. Let me ask you this question. If you go for your health screening, most of the time the person involved or the doctor will ask you about your gut health, your heart, your appetite, your weight, everything. But anybody ask you about your health related to your menses? No, they're only interested is when is your last menstrual period to make sure that you're not pregnant when you go for your x-rays. But nobody delved into details about your menstrual health. Okay, so that is why I think it's often neglected. So I hope this topic will highlight some issues related to menstrual health. Menstruation is a very wide topic and it actually requires half a day of lectures to actually cover all aspects. So what I'm going to do is I'm going to give you a brief overview of all these topics, menstruation, what are the health impact, the health issues associated with it, and how to recognize what is normal and abnormal, and when to consult, and what are the treatment options that you have, whether it's medical, surgical, or non-medical at all. At the end, I think what is most important for everyone is that you will be able to recognize the huge impact on health, and how to recognize that there's something wrong and what to do about it, and when to seek help. There are three broad topics that I'm going to go into details, and they are actually all directly related to menses. First of all is the abnormal menstrual bleeding. Then there's menstrual pain. In medical term, it's called dysmenorrhea. And thirdly will be the physical and psychological symptoms associated with menses. In the next few slides, I will discuss the significant health impact due to these menstrual disorders. Now, in modern society now, it's estimated that each woman will experience roughly about 400 menstruation between menarche and menopause over a period about 40 years. Now, if you put this in days, each woman will bleed about 4 to 6 years over her lifetime. Actually, sometimes this is underestimated, If you calculate properly, it's up to about 7 years for some women. That's an awful long time to be bleeding, isn't it? If you imagine it, So abnormal uterine bleeding affects up to about 10 to 30% of reproductive age women and up to 50% of perimenopausal women. Therefore, it's not uncommon, and it accounts for a high percentage of gynecological consults in the hospital in the Western society. Not so much in, I think, the Asian population, because I think in the Asian population, menstruation is something to be accepted, something to be suffered. Say, look, when I was your age, I was having the same problem. So why are you complaining? You know. So, and most of the time when I see the women ended up in the hospital, their hemoglobin is about 5, 6, or 7. They've really lost half of their blood volume. Only then they realize there's something wrong. In a review of 500 perimenopausal women, 18% had heavy flow, And out of this, 1/5 actually due to pre-malignant or malignant disease. It just means that in older women, you have to see a doctor because the possibility of significant abnormality is higher. You know that cancer risk increases as you age. So when you are aging at 40 plus, early 50s, and you are having abnormal menstrual bleeding, you better see somebody because there's a high chance that there may be a precancerous change, which is quite common. So therefore, if you treat the precancerous change, you actually halt the progression to cancer. So, and review of all the literature, all the data shows that menstrual bleeding has a major impact on women's quality of life, the productivity, and the utilization of healthcare services. Okay, if you look at, by the end of my health impact slides, you know that breast cancer risk is 1 in 20, 1 in 30, in terms of women lifetime risk of breast cancer. Breast cancer, But if you look at the suffering from menstrual-related disorder, you cannot even compare because it's so common. If you look at the pain, 50 to 90% of reproductive age women worldwide describe experiencing painful menstrual period. And the school absenteeism rate of 10 to 20% have been reported globally. Now, those with severe pain or pain that kept the women from work or her daily activity ranges from 3 to 18%. In other words, up to 20% of women will be affected by menstrual pain, and this can directly affect their school or even work performance. 20%, which is very high. Okay, if you look at the internet-based survey of 32,000 Dutch women from 15 to 45 years, published recently, 2019, 13.8% of women reported absenteeism during their menstrual period. About 14%. 3.4% reported absenteeism during every or almost every other menstrual period. Meaning, every month, they will be knocked out. Can't even do anything. Can't even go to work, can't even go to school. Up to 3.4%. 4 out of 100, 3 to 4. A mean reduction of productivity of 23 days per year, which is really significant. If you put it in dollar and cents, I think it will be amazing, the amount of money lost. Okay. In Canada, a random survey of 934 women above 18 years old with primary dysmenorrhea, primary period pain. 60% describe the pain as moderate or severe. 15% limiting their activities. 50%, half, and 17% reported missing school or even work. So therefore, I think the absenteeism rate, significant rate affecting work, school, is up almost 20% consistently. These data show that many of these young women run the risk, isn't it, of falling behind during their years of schooling, a crucial time in their academic life. For poor work performance as they grow older will also affect their career path. Can you imagine? They will also miss out on social activities, sports, and other school activities because of their menstrual symptoms. Then they have this called PMS or premenstrual syndrome. many women have some uncomfortable symptoms prior to their onset of menses. Luckily, many are able to cope. However, 3 to 8% of them will experience debilitating symptoms leading to functional or psychological impairment. Therefore, the menstrual bleeding, the pain, and the significant premenstrual symptoms associated with menses can be a significant health issue for some women. Imagine if this is recurring every month and multiply by the number of cycles, the health impact is really, really significant. Imagine you know, oh, my period coming, oh, I'm going to suffer. And then every year, every month, you know, you're expecting that. I think that is not something to look forward to. In the next few slides, I will explain a little bit about menstrual cycles. Now, menstruation just refers to shedding of the endometrial tissue, and then there will be passage of blood through the vagina. The first menses is called menarche, and then the last menstrual cycle is called menopause. The definition of menopause is last period 1 year ago. So it's a retrospective diagnosis. You know you're menopause when you don't have period exactly 1 year. So now, the menstruation process, starts with the process of preparing the lining of the uterus for implantation and support of the fertilized egg. But when no egg is being fertilized, a cascade of hormonal events will take place that results in shedding of this lining. At the beginning of the cycle, there's 4 hormones that are important during cycles, menstrual cycles. The FSH, the top one, LH, and then you got estrogen, progesterone. In the first half of the cycle, the FSH will rise to stimulate estrogen. Estrogen will stimulate the lining to grow. And then in the mid-cycle, LH will rise, causing ovulation, egg release. With the egg being released, the progesterone level will rise to prepare for acceptance of the fertilized embryo. Okay? This cycle is repeated monthly or irregularly depending on the individual hormonal environment. If pregnancy occurs, the endometrial layer will thicken to support the pregnancy. Okay? If there is no pregnancy, at the end, all the hormone will drop, okay, causing the endometrium to be unstable, and then eventually it will shed. Therefore, it's always important to rule out pregnancy if the menses is delayed in a woman who has regular cycle and sexually active. Therefore, the menses is actually every month when you shed is because there's no pregnancy, and then restart all over again to prepare for pregnancy, the implantation of the embryo. So the lining is actually to prepare to accept the embryo. Therefore, in other words, the menses is basically for one reason only, pregnancy. If you don't want to get baby, the menses is a nuisance. It has no health benefit. The Chinese, I get sick and tired of the Chinese people come and tell me, no, you give me this menses and then don't make the menses don't come. All my toxins, where are you going to go? They think the menstruation is to detox, which is false. Okay, this shows the endometrial layers. It's not difficult to imagine, isn't it, that the bleeding will be heavier if the lining is thicker than normal. For example, when the menses is delayed, there's no release of the progesterone, the estrogen continue to stimulate the lining. So the lining become very thick. So a woman who have irregular cycle, the period only come 3 months, 4 months later. So imagine the lining continue to grow. I always say menses is a grass, you know. Every month the grass cutter come and cut. They use 2-3 plastic bag only. But the grass cutter didn't come for 2-3 months. When he comes, he becomes lalang. he has to use 5, 10, 20 plastic bags. It's the same. So the lining continues to grow, and then when it's shed, it's really torrential. Or birth control pill works by thinning out the lining. That's why women on birth control pill, the menses are actually very scanty, less, because they actually prevent the overgrowth of the endometrium. Secondly, you can imagine the endometrial layers has blood vessels. So if a woman's endometrium, for some peculiar reasons, contains a lot of blood vessels, so you can imagine they will bleed more. Now, during menstruation, the endometrial layers produce a chemical called prostaglandin, which is important in inflammatory process, to control the inflammatory process. But in some women, certain prostaglandins are more than others, and this excess prostaglandin cause the vessels to dilate. Therefore, they bleed more. Therefore, some medicine will be helpful for this kind of problems, which I will discuss later. In normal menses, all these vessels, when you have menses, they are supposed to constrict and then reduce bleeding. But because you have excess prostaglandin, they fail to constrict, they still dilate, so you keep on bleeding. Therefore, some of the drugs used to treat heavy menstrual pain works this way, by constricting the vessels, by reducing that bad prostaglandin, and by plugging up the vessels with clot. You plug up all the clot, then the bleeding will be less. So that's how some of the medication works. Now, abnormal bleeding pattern can be heavy, a lot of clots, torrential bleed, or can be prolonged in terms of duration, maybe bleed for 3 weeks, 4 weeks, cannot stop. Or too scanty, staining but continuously, for weeks. Or when you have bleeding between menses, it's called intermenstrual bleeding. The length of menstrual cycle varies widely from women to women. Okay? And even within the same person, certain cycles may be different as well. Okay? So I always say no woman has perfect menstrual cycle in their life. So they always say, hey, all this while my period is normal, but why now I delay for 2 weeks? So I always say, look, nobody has a perfect cycle all your life. One fine day, your cycle can become irregular, is still perfectly fine. Most cycles are between 24 to 38 days, and it occurs at a very regular intervals, with a variation of up to 9 days, plus minus. Now, the duration of flow is between 4 to 8 days, and normal volume is usually less than 80 mils. From research, when they look at all the women, they measured all the menstrual blood, the average out is actually less than 80 mils. Now, then, what is heavy menstrual bleeding? Strictly speaking, by definition, heavy menstrual bleeding refers to bleeding of more than 80 mils in one cycle. But it's impractical, isn't it, to go and measure your exact volume of blood loss, and it's actually not feasible in real life. Impossible. You can't do that. Therefore, in a more realistic way, heavy menstrual bleeding is defined as volume that interferes with the woman's physical, emotional, social, and material quality of life. So it's actually a very broad definition. Now, the flow will be heavy if there is presence of clots. When you soak pad or tampons more than every 2 hours, every 2 hours you need to change. That is actually overflow, staining clothes or sheets, affected sleep, work, and when there's presence of anemia. So the anemia part, when you check the blood test, hemoglobin of 7, 8, in a person staying in Kuala Lumpur, Klang Valley, middle income, you have no business of hemoglobin 8, isn't it? So you must be either not eating well or you are losing somewhere. So, from the history, it's quite obvious as it's actually from the menses. Now, there is also a wide variation of bleeding in terms of amount and the pattern. a marked change in the women's own pattern is probably more important than when you compare between woman to woman. So if you have to see your own pattern, and then if there's a change, then you have to decide whether that change is significant or not. But because you cannot compare different women, because each one may have its different menstrual pattern. However, like I said earlier, the assessment of bleeding amount can be quite difficult. You can't objectively measure it. You just infer whether it's heavy or not. And often, this inference is actually not accurate. It's subjective in clinical practice. Always say, don't trust the woman. You know why? Because 20% of those lost less than 60 mils, which in fact actually normal, claim that their period is heavy. These are from interview, and then they measure objectively. Whereas 40% loss of more than 80 mils, scientifically called heavy menses, claim that their period is light or moderate. So, therefore, assessment based on clinical history is often not reflective of actual flow. Many of us in the medical profession, we will start treatment, in fact, based on the woman's perception of bleeding and whether there's associated anemia. Because if she said, my period is heavy, I can't stand it, and I want treatment, we will treat. Okay? And if you say, no, my period is not heavy, but hemoglobin 8, I will still treat. So because she is the 40% who thinks that my period, no problem. But why is it your hemoglobin 8? I will treat. Now, there are a few helpful questions they may often ask to assess the amount of bleeding. If you look at it, the first one, the question would be, how often do you change your sanitary pad or tampons during the peak flow days? How many pads of tampon do you use over a single menstrual period? Do you need to change pad or tampon during the night? How large are any clots that are passed? Has a medical provider told you that you're anemic? Women with women with normal menstrual flow typically will change pads or tampons more than 3 hours interval. So one day maybe 3, 4, or 5 times, not fully soaked. They use fewer than 21 pads or tampons per cycle. You're talking about 7 days flow, for example. 1 day 3, you're talking about 21, no? Right? If you have 5 days, so that 5 days, 2 days may be a bit heavy, you may use up to 4 or 5 pads. So that's still normal. Seldom need to change pads or tampons during the night. If you wake up 2, 3 times to change, there's something wrong. Okay? And clot less than 1 inch in diameter, probably 1 inch 50 cents, less than that. Anything more clotty is abnormal. And you're not anemic. So these are some guide to assess whether you are actually having heavy period or not. Now, these are normal variation of menstrual cycles. Irregular cycles, every 2-3 months once and all that is okay, provided you have more than 4 menses a year. If your cycles are irregular, it's still fine, provided you have more than 4 menses a year, and the flow not more than 7 or 9 days, and not heavy. Scanty flow also can be normal in a regular cycle, so don't worry. Okay, as long as your interval more than 21 days, quite consistently you have menses, but it's only for 2 days, 3 days, very little. I always say, less is better. Why one more? Okay. Now, the abnormal variation will be those that have less than 4 menses per year. 4. Because, especially those who are not on hormonal therapy, and those who are overweight and polycystic ovary syndrome. Polycystic ovary syndrome is a hormonal problem related to the ovaries, causing irregular menses. Now, if you have less than 4 menses a year, you run a higher risk of getting pre-cancer of the endometrium and cancer of the uterus. So, even you are 30 years old, you have only 2-3 menses a year, you're overweight, please see your doctor to regulate your menses. Those with prolonged flow or intermenstrual bleeding also is abnormal. Now, what are the causes? Well, most famous one will be the fibroids. Fibroids typically can cause heavy menses, either excessive, prolonged, or irregular, sometimes can cause pain. But bear in mind, 20 to 30% of women will have fibroid. But only 50% will be symptomatic. Because many women walking around with fibroid, they don't know, they got no symptom. That's fine. But 50% of them would have symptoms. And one of the symptoms will be, of course, heavy period. Now, there are a few types of fibroid commonly seen. One is with the submucous one here. Then you got intramural, then you got subserosal. The worst one to have is actually the one submucous. The two that is growing into the endometrial cavity. You can imagine every month when you bleed from this area, you have a fibroid sitting there, increased blood flow, increased surface area, it will contribute to more bleeding. So these are the worst one to have. Even 1-2 centimeter, it can cause trouble. The next one will be adenomyosis, which is a condition in which the inner lining of the endometrium is found within the muscle of the uterus. Okay? Somehow it's supposed to be there, but it has grown into the wall. So during menstruation, this area bleed as well and cause accumulation and blood and inflammation. Therefore, it can cause menstrual cramp, lower abdominal pain, and then bloating plus heavy period. Over time, the accumulation of these endometrial layers and the blood and all that will cause the uterus to enlarge, and the pain symptom will get worse with time. Then endometriosis. Now, endometriosis is characterized by the presence of endometrial tissue in locations outside the uterine cavity. Just now, it's the same thing. Just now you have it in the wall, it's called adenomyosis. If you have it outside the uterus, it's called endometriosis. Either can be on the ovary or in the ovary, the tubes, and anywhere else in the abdominal cavity or in the pelvis. Now, during menstruation, this area breaks down and they bleed and cause significant pain and eventually formation of endometriotic or chocolate cysts in the ovary. So the main problem is more of a pain, not commonly cause excessive menstrual bleeding, but still can. Then other causes are endometrial or cervical polyp, and then you got the dysfunctional uterine bleeding. Then you can get cancer of the uterus or cervix. Then those on certain hormonal contraceptive or intrauterine device. Intrauterine device, the copper one, for contraception can cause heavy period. Now, DUB refers to a condition whereby there's no obvious cause found, and usually due to hormonal issues or local endometrial factors. Non-gynae causes are some endocrine disorder, thyroid, for example, coagulation problem, and certain medication. If you got a heart problem, you are taking all this medicine that dilute your blood, you may actually have heavier period than normal. And some herbal therapy also can contribute to bleeding. Tongkwai, ginseng, ginkgo, things like that, Now, during consultation with your doctors, assessment will include a clinical examination to make sure you're not pale, and then a speculum will be required. Speculum is to insert a small little plastic device into your vagina to look at the cervix to exclude cancer or growth, cervical cancer. And if you have not done a cervical cytology smear in the last 1-2 years, it will be done for you. We now use what we call the liquid-based cytology called thin prep. Pap smear is an old term, now no longer used. It's a layman term. Now we use a liquid-based one called thin prep. Ultrasound scan of the pelvis will be done to look for fibroids, adenomyosis, polyps, any growth in the uterus, and the endometriotic cyst. Blood test, of course, is more objective. We will actually look for the hemoglobin level. Now, in women above 40 years old, abnormal menstrual bleeding, and if the ultrasound shows endometrial abnormality, thickening, for example, suspicious, then the endometrial biopsy is necessary. In the olden days, when you're late 40s, 50s, when you're bleeding, the doctor will suggest a DNC, dilatation and curettage, bring you to OT, put you under GA, scrape your uterus. Now that is no longer being done because DNC is just to get the lining for biopsy, for histology. Now you can do that in the clinic by putting a small plastic tubing called Pipel into the endometrial cavity and aspirate some tissue to send to the lab for histological examination to exclude precancerous change or even cancer of the womb. And the accuracy is about 98%, which is actually good enough. It's an outpatient, no need to subject you to more invasive procedure in the OT and the cost more. In fact, this is much cheaper. Hysteroscopy is a procedure that allows us to look into the uterus in order to diagnose and treat causes of abnormal bleeding. If you find that if we scan and we think that there's a growth in the uterus, this is a gold standard. To put a camera in and have a look. Okay? This picture shows a submucous fibroid, and it needs to be removed because this is one that causes heavy period. And it can be done using the camera system, the hysteroscope, as a daycare, put the camera inside, remove the fibroid, and you're home on the same day. Minimally invasive, painless, quick recovery. Now, what are the treatment options for heavy menstrual bleeding? First of all, we have to look for causes and treat. Even if you have a fibroid, we think that the fibroid may contribute to heavy bleeding. Sometimes medical therapy is good enough. For example, in the younger, early 20s, mid-20s, they have fibroid, you have adenomyosis. We still treat medications to actually reduce the flow. And then one of them is called tranexamic acid. I told you, the vessels is dilate, they bleed, all your pipe full blast. Tranexamic acid is to cause clotting and plug up all the vessels so that it stops bleeding. So it works that way by increased clotting. But you must take it at the beginning of the menses. Meaning, your period heavy on the second or third day, very heavy on the second or third day, you take it when the menses starts today. Don't take it during heavy flow, too late. You must take it on the first day of menses for about 2 or 3 days. So I teach the patient to adjust themselves. Sometimes they say, 2 days is good enough, fine. Sometimes they may need 3 days, but they adjust themselves. So this is very effective, and it can reduce the menstrual flow by up to 50%. Good enough. So every month you only take it for 2 days or 3 days is fine. Then you can go for your sports, you can do whatever you want because the bleeding is reduced by half. Then if the bleeding is associated with cramps, then a drug called non-steroidal anti-inflammatory drug will be useful. Typically, these are very famous ones. It will be Ponstan, Synflex, Voltaren, Nurofen. These are the ones. Okay. You see, like I said earlier, some women, they have increased prostaglandin, the bad ones, that causes dilatation of the vessels. Instead of constricting, they dilate. And then this prostaglandin causes uterus cramp. So this NSAIDs works by reducing the production of this bad prostaglandin. Reduce it so that your menses flow will be less, your cramp will be less. Again, it must be taken prior to the onset of severe pain. If you take it when you are on the bed, severe pain, you realize that it doesn't really work. You must take it prior to the onset. So you have to learn when to time it to take it. And the menstrual flow can be reduced by about 20-30% with NSAIDs. If you have bleeding alone without much pain, tranexamic acid is better. But sometimes I combine both, tranexamic acid and, for example, Ponstan. Then the effectiveness will be higher. For people who are keen for birth control, then birth control pill will be ideal because it reduces the flow, reduces the pain, provide contraception, regulate the cycle. And it will also less ovarian cysts, less endometriotic cysts. Other birth control methods are mainly hormonal, either pill or injection, and also there's a type called intrauterine device with hormone called Mirena. Okay? All these cause significant reduction in flow and sometimes no menses at all. It is a good thing and has no health impact if has no menstrual flow due to this type of hormonal therapy. So in fact, no period, even better. Yeah. Okay. There are 2 minimally invasive surgical options available if you have heavy menstrual period. First one will be called endometrial ablation. It's a procedure that destroys the endometrial lining. Okay? And by destroying it, there will not be monthly growth of the endometrial layers. Therefore, bleeding is be less. Okay? And it's relatively painless. It's a daycare thing. Do it today, you're home, tomorrow you're back to work. Okay? Then the other one is called uterine artery embolization. It's a procedure done by the interventional radiologist. We use a catheter to actually poke inside, look for the blood vessels supplying the uterus, and then block it. It's simple analogy. Reverse of heart attack. Heart attack means your coronary vessel blocked. So what did they do? They do a catheterization, do a stenting, unblock it, put a stent. They unblock. It's the opposite. Same way, go in, look for the vessel, they block it. Reverse. So there will be no blood supply to the uterus. Therefore, the uterus will become smaller and no menses. Okay? But these two procedures does not affect women's hormone. You are just targeting the uterus. The ovaries are still functional, still produce hormone. You are not menopause yet, although you do not have period. So these are ideal for those who are completed family in their 40s. Minimally invasive. You still have your uterus, you still have your hormone. And both of these options are available in SGMC. If you go and read out about endometrial ablation, there are various ways of doing it. In SJ, I use a hysteroscope to scrape and burn. Other places may use it's a balloon with hot water, can use laser, can use radio frequency. And those days when I was in the government, I used microwave. Oh, you can use microwave to cook your food. You can also use it to cook the uterus. So now, if all else fails and there are other indications, then the hysterectomy, it will be a cure. It's a major surgery, so you only do it when you have very specific indications. When you do a hysterectomy, you can actually retain the ovary in a young woman in their 40s so that you're still not menopausal in the sense that you don't have period, but you're still got hormones from your ovary. You can keep the ovary. But those above 50, then you should remove your ovary. Second topic will be pain. It's a common problem experienced by women. I told you about 50 to 90% of women will experience menstrual cramp in varying degree from mild to severe. Okay? Primary dysmenorrhea just refers to those that has no obvious cause, more commonly in teenagers in their 20s. Then there's a secondary type, usually due to some underlying pathology. Endometriosis is very common. Then you've got adenomyosis and fibroid. When severe, in addition to impairing quality of life, it may also interfere with work performance, like I told you, leading to absenteeism and poor work performance. So it's actually quite significant impact on the quality of life. For primary type, the pain typically starts 1 to 2 days before, okay, and reduce over 12 to 72 hours. So they just get pain just before coming. When the period comes, increase in intensity, then slowly reduce. It's crampy or intermittent and sometimes continuous, dull, non-specific. Location usually lower abdomen, back, and back pain is quite common, and the thigh pain as well. Severity can be mild, nothing much, to severe. And usually there's also associated symptoms such as nausea, diarrhea, fatigue, headache, body aches, malaise. And these type typically improve as they grow older or they have children. Then you have the types called secondary, which starts later in life, more severe, before and during, more severe, and it can occur before, a few days before, worse during menses, and it actually peak, and sometimes some people after menses stop still continue. So over time, this become worse. So it's usually due to a pathology. Again, principle of treatment is actually quite similar to heavy menses. First of all, you look for causes and then treat the causes. Normally, even we find the cause, we treat conservatively with medication first. They improve, we just follow up and monitor. Painkiller NSAIDs, I explained how it works because it actually targets the increased level of the abnormal prostaglandin. Birth control pills also same thing, okay? So it reduces the bleeding, reduce the cramp, and the other birth control pills, which is a hormonal type also, if you stop menses totally, then there's no pain actually, right? Now, you take birth control pill, if you take the conventional way, 20, it's actually 21 days, break 7 days, 21 days, break 7 days. If you take it this way, you will have 13 menses a year. Not 12, 13. Because 21, you break 7 days. In the 7 days, your period comes. Because 1 year got 12 months. But you ended up, because you're bleeding every 25 days, you have 13 menses. That's an awful lot of bleeding. So I prefer to give birth control pill, continuously take it for 3 packets. So you only bleed every 60 over days. So you have 6 menses a year, 50% discount. Better, okay? Now, some studies shows reduced pain intensity and duration with exercise compared with usual care. However, the optimal type, duration, and frequency of exercise to relieve symptoms is not known. Nobody knows, which is the best. Plus, it's not easy to advise women to go out and run, isn't it, when they're having period bleeding and pain. So I think it's easier said than done, this exercise thing. But worth a try if you can do it. I mean, that's all I can say. But you tell the woman, must go exercise. I mean, how to exercise when you're bleeding and having pain? So it's not easy. Heat pack can offer some relief, but may not be enough for others. Some people does get relief, but actually the relief is actually a little bit only. As for acupuncture, well, no strong evidence that says that it's effective, very effective, and cannot be generally recommended as a treatment. First line. Most studies done about acupuncture in relieving pain due to menses are actually of poor quality and very subjective actually. But generally, most of us think that if you want to go for acupuncture, you can go ahead and try and see. No harm done actually. Okay? See if it works for you or not. Now, dietary changes in reducing pain also not fully proven. Some people swear by certain things like low-fat vegetarian diet, increased intake of dairy product, vitamin E, vitamin B1, B6. Some people even say evening primrose oil, fish oil supplement. You can try, but don't expect too much. Okay? So, then lastly, there's one called transcutaneous electrical nerve stimulation. This has some scientific basis and may be useful. It involves putting in electrode pad on the area of pain, lower abdomen, connect to a device that discharges electrical current. So they discharge electric current and flood all the nerve fiber and confuse all the nerve fibers so they cannot transmit the pain signal to, it's caused traffic jam. So it causes traffic jam just because you release all the electrical stimulus. So, but I'm not sure how much it affects your brain. Don't ask me. So, but it also causes release in our own natural pain relief chemical called endorphins. So it works these two ways. Useful for those not keen to take medication, but they found that the pain relief is actually less than if you take painkillers. So it's not that fantastic. You can buy it in the market. I think it's about $600-700. They can use it for childbirth as well, labor pain, that. But again, the pain relief is actually much lower compared to medication. Now then, PMS, premenstrual syndrome. It refers to physical and behavioral symptoms that occur in the cyclic pattern, in the second half of the menstrual cycle. Some women get their period without any signs of PMS or only very mild symptoms. Then they are very lucky. Okay? This mild PMS affects up to 75% of women with regular menstrual cycle. For others, it can be so severe that their quality of life is really affected. Up to about 3 to 8%, I think. Yeah, I mentioned earlier, 3 to 8% will be severely affected. Common symptoms are mild ones are abdominal bloating, cramp, irritability, breast, joint pain, and in fact back pains, body ache. Sometimes they may even have fever, mild fever. That's why it's also called period flu. Before period, like you're having flu, Imagine having flu every month. Wow. I have it once a year also suffering already. Okay, there's a whole range of physical symptoms and psychological symptoms, one whole list. I won't go through them. You can actually check it from the online resources, So, but can you imagine all this happens every single month? It's terrible. Treatment. Well, like I said, you can try regular exercise, some form of stress management and relaxation, dietary supplement, such as B6, calcium, magnesium, EPO, for example, the whatever diet, vegetarian diet, however, these are not really proven, all these, for everyone, but may worth a try if you want. Okay, no harm, but not easy to go and adhere to all these things when you are down and out and you no mood, so it's not easy. If severe enough, you can try medication. The available options are painkiller, NSAIDs or paracetamol for your pain and headache, body ache, your fever. And then there's a type of depression pill or anxiety pills that can be used at low dose just before menses when the symptom starts. Take it at very low dose and then continue when the period starts and then can stop. Because once the period starts, usually the symptom will subside. So you only take it for a couple of days and it's actually proven to be quite effective and it's very safe. So if you have that, mainly the psychological symptom, behavioral symptoms, I think this medication will be useful. Birth control pill is also effective, and there is one particular brand that is actually specifically licensed to treat PMS. Birth control pill is called YES, Y-A-Z. Okay. So in summary, menstruation has significant impact on health, like I mentioned earlier. It's not physiological necessary for women not willing to conceive. It's a nonsense, actually. Not important for health at all. In fact, now, most modern women experience many more menstrual cycles in their lifetime than women in the prior generation, your great-grandmother. Okay? Because of early menarche, fewer pregnancy, less breastfeeding, and later menopause. Now, more and more women now having gynecological problem, fibroid, endometriosis. Why? 25 years old got fibroid. 30 years old got adenomyosis. All that. If you look at the maybe 2-3 generation, your great-grandmother, first period, how old? 15. 18 years old, got married. 19-year-old, first baby. By the time they are 35 years old, 8 children. Can you count how many periods they have until they are 35 years old? Very few. By the time the baby 1 year plus, still breastfeeding, boom, pregnant. No period. So you ask them when you're 35 years old, when was your last period? Huh? When I was 18 years old, when I got married. So, therefore, they do not have fibroid, endometriosis, adenomyosis. So sometimes they ask me, hey, how to prevent this? Get pregnant every year. Well, the health and the socio-economic impact of this high prevalence of symptoms cannot be underestimated, isn't it? Because they may result in absenteeism and poor career advancement. So in order to ensure basic knowledge, so I think everybody has to play a role. The school, the workplace, to educate women on menstrual and support them if they have menstrual pain and advise them to seek help. If you find that your colleague keep on absent because of menstrual pain and all that, better tell them to seek help. Otherwise, why suffer every month, right? So those involved in adolescent health, for example, have an important role in counseling girls about menstruation-associated symptoms and when to seek help. Don't suffer in silence. Consult with primary care physician early so that you can elevate pain and suffering and also protect your reproductive health. There are many medical and non-medical therapies involved, including surgery to manage all these problems. This gives an opportunity for early detection of precancerous and cancer lesions as well. Not only reduce suffering, like I said, but it's beneficial for long-term health. Most of the options, if you take pills, are actually to reduce the volume of bleeding and duration and abolish menstruation altogether. Okay? For those with menstrual-related issues, it is important for them to track their menstrual cycles. It's also not only that, but if you're planning for baby or don't want baby, also important to track. Okay, so there are various ways. I think now there are two options now. Either use a pen and paper and diary or use a smartphone app. Okay. It's useful to track when your period starts, how long it lasts, amount of bleeding, any associated symptoms, any pain that you have. Once you have, then you talk to your doctor about what is normal for you and any symptom that you have that is new or different. Because if you don't track, sometimes you cannot remember. I think the conventional way this one is better. I still like this. Because one look, you know what's going on. Okay, so for example, this one, for the whole year you track, then you know, what's the duration and all that. And S is for spotting, B is for bleeding, and then you shade if in case it's too heavy, things like that. So you can do, one look actually tells you everything about the menstrual cycle, normal or not normal. I think the important message here is that to have some knowledge on what is normal menstruation, and then make sure that you know what is yours, whether it's normal or not. Assess if there's any significant bleeding, pain, or PMS symptoms that affect your quality of life related to your schools, your work, or even your social life. If yes, then it's time to see your doctor to discuss this and make sure you get a correct diagnosis and a long-term treatment plan. Must have a plan. Okay. Now, there are so many articles coming out to discuss about why menstruation is unnecessary, and many women now opt for menstruation suppression, either because they have a gynae problem or for their lifestyle choice. They are active women, sports, they need to work, so they don't want. So it's not only because of pain or bleeding or PMS, but sometimes also for hygiene purposes. So you're going trekking, you're working in Africa, things like that. So sometimes it's also for that reasons. Now, the simplest way for this is most of the women will be taking birth control pill or some form of hormonal contraception that actually reduce or even eliminate menses altogether. For some, having less or no menses at all is a blessing. Okay, I'm coming to the end of my lectures, and I would like to highlight that there's such thing as such a day every year to create awareness. It's called World Menstrual Day, and it falls on 28th of May every year. So, do you know about it? Everybody know about World Heart Day or whatever, cancer, breast cancer. Nobody know. Coming to keep a lookout for this date. Now, lastly, if you look at this word, menstrual, what does it really mean to you? What does it mean? My last slide. To me, menstrual means men should be involved in issues related to menstruation. Women should seek help and knowledge if they have issues. Society should eliminate taboo surrounding normal physiological process in women. Everyone should respect and understand the role of menstruation and how it can affect one's health. Take action into your own hand as an individual. Collectively, the government and everybody else should also take an active role in education and reduce the morbidity associated with it. Okay? And finally, hopefully, all women should be able to live a good quality of life free from menstrual-related disorder. Thank you.
Thank you, Dr. Lee, for the insightful presentation. Ladies and gentlemen, for the next session, please join me in welcoming Dr. Daphne up on stage to share on the importance of being more breast aware.
Hi, morning everybody. It's nice to see all of you all. You've taken the time off to come on Saturday to join us. All right, so I'm going to start off with a few simple questions, right? Are you breast aware? Do you know your breast? Do you examine your breast every month? Show of hands. Those who examine their breast every month, that's good. The rest, no? Oh, very few. So how healthy are your breasts if you don't examine it every month? So how do we know, right? So it's very important because breast health is an important part of our overall health and well-being. So how do we maintain breast health? By being breast aware. You must know how your breasts feel on a daily basis, right? Because if there is any changes, you will be the first person to know. If you don't know how your breast feels, how are you going to pick up any changes, right? It's very important. Second, being aware about breast screening. What is breast screening? Where is it available? Available in my country, in my state, which hospital? What is included and encompassed in breast screening? And being aware about breast cancer risk factors. What are your risk factors? And being aware on how to reduce your breast cancer risk. So you must know about the risk factor for you to be able to be aware on how to reduce your risk. Alright, so first thing, not all breast lumps are cancerous. Sometimes somebody feels a breast lump and they get very afraid, they panic. But most times, most breast lumps are not cancerous, especially in the younger age groups. Right, so if you feel a breast lump, sometimes, most commonly it is something what we call a fibroadenoma in the younger age, or a breast cyst, or fibrocystic disease. All of these things can present as a breast lump. So not all breast lumps are cancerous. But whenever you feel a lump, you must go and see a doctor to ascertain what it is, right? Okay, so breast cancer screening modalities, what is it? First of all, self-breast examination, very important, all right? And then, of course, seeing a medical practitioner, a doctor, to get yourself examined, and then a screening mammogram. So, breast self-examination. It must be done every month if you are younger, still menstruating. Once every month, 10 days after your periods. Because just before your periods, during your periods, your breast will feel a bit lumpy. So if you examine yourself, then you get a bit confused, right? And it's already very painful and tender, very difficult to feel anything, right? So 10 days after, from the first day of your period. For women who are already menopausal, choose any day. I suppose it's easier to choose the first day of the month to examine yourself. So how do you do it? You stand in front of the mirror, you look at your breast, right? Look for symmetry. Look if there are any changes in the skin, any redness, how the nipple looks like, all right? Then put your hands on your hips, press down, look at your breast in the mirror. Does it look the same? One moving a bit funnily, looks different. Lift up your arms. Do your breasts move up symmetrically? Or one is down, one is up? That's not right. Okay? Bend forward, Bend forward and look at your breast again. Do they look the same? So these are all very important to be done when you look at yourself in the mirror. Then gently squeeze your nipple. Gently is the word. Okay, look for any nipple discharge. Alright? Then lie down, use the the flat surface of your fingers to examine your breast. Do not press. If you press like this, you feel there's a lump everywhere. Alright? Okay, so use the flat surface of your fingers and move from outer, inner, from out towards your nipple. Out towards your nipple, cover the entire surface of your breast. Then make circular movements. So if there is a lump or there any nodule inside, you'll be able to feel something. Okay? So when we're doing this examination, we are looking for lumps. we're looking for changes in the nipple. Is the nipple retracted, meaning it's gone inside? Is there a discharge from the nipple? The skin around the areola, is it different? The color is a bit different. Does the skin look cracked, or there's a rash? These are all the things we look at, whether there's dimpling. Okay, look at this box of lemons. All right, so look at this. Dimpling. This is some lesion on the skin. This is some redness on the skin. This is a nipple discharge. This one, the skin of the breast looks like it's orange peel appearance. This one is an obvious bump. And this is obvious veins on one breast. If both your breasts have got obvious veins, that is fine. But if one breast has got obvious distended veins, then it must be examined. This is a nipple that's gone in, a retracted nipple. This one even I don't know. Okay, so this picture, what do you all see? There's a breast lump here, right? Closer view, there's a breast lump, the upper part of a breast. This one, what do you all see? This nipple, that's not right? If you compare it to this nipple has gone in, it's retracted. So we take a closer view at it. There's actually some nipple discharge here as well. This one? This is a retracted nipple. If you have retracted nipples from birth, that's fine. But if suddenly along in the middle of your life, suddenly your nipple gets retracted, that is a fishy symptom that you must come and get checked. All right? This one, what do you see? This side, the nipple, there's an ulcer there. Closer view. Can you see? There's an ulcer there. So this is cancer of the nipple areolar region. It's called Paget's disease. This patient, actually there's nothing wrong with her breast, but can you see here? Under her arm, her lymph nodes are swollen. All right? Because the breast cancer, the first place it travels to is your lymph nodes under your arm, and she's got swollen lymph nodes. Okay, so what should you do when you find an abnormality in your breast? What do? You come to the hospital, you see a doctor, your doctor will examine you and decide whether you need to go, whether at all what you have found is something which is true. If there is something, then she will decide whether you need to go for an imaging. If you are less than 40, we will send you for an ultrasound. If you are above the age of 40, we send you for an ultrasound and a mammogram as well. All right, then from this imaging, we will decide, and we can be able to see if there's anything wrong in your breast, whether anything was picked up. If it is something benign, like what I said earlier, like a cyst and all that, then that can be left alone because it is not dangerous. But if there's anything suspicious, then we proceed to do a biopsy. All right, so that's the flow of things. So when we talk about breast screening, the best chance of cure for breast cancer is when it's diagnosed at a preclinical phase. What does that mean? It means that if you diagnose breast cancer even before you feel it, that means on a mammogram or an imaging, your chances of cure is very good. So almost 100%. Right? So that is why we keep telling people, go for screening, examine yourself, go for screening. All right? So when do you need to go and start screening? From the age of 40, you should have a mammogram done once every 2 years, all right? And while the doctor does a mammogram, we'll also do an ultrasound. It works as an adjunct, a tool to help us determine the lesions that we see on a mammogram. If you're below the age of 40 and you feel a lump, or you feel an abnormality in your breast, then we will do an ultrasound. Otherwise, you don't need to come in for mammograms, all right? And MRIs, when is that done? For some patients who have implants, they already have breast implants, then we would do screening using an MRI because that would be more sensitive. So this is how a mammogram machine looks like. What happens is your breast is pressed between two plates. So a lot of women are afraid to do mammogram because they think about the pain. Is it going to be excruciating? Going to squish our breast? No, I mean it's just a little uncomfortable, but it is not excruciating. And when you think of what you can prevent, please come and do your mammograms. All right? So this is an image of a mammogram where you can see the lower part of it is how a normal breast would look like. See this upper part that looks like a white star, so that is a suspicious lump. That is most likely cancer. All right, so an ultrasound is done by the radiologist. Okay, so you put an ultrasound probe on your breast and move from every quadrant to look and assess whether there is anything. So this is an image of a very irregular lesion. When you see something that is not nice and smooth, it is always suspicious. So when we see something suspicious, then we would decide whether you would need a biopsy or not, first to determine whether that lump is cancerous or not. So what is breast cancer? The female breast is made up of lobules that make your milk and ducts that connect these lobules to the nipple. And then the surrounding area is what you call the stroma or the fat tissue. So cancer can happen anywhere along this area. The most common part is cancer happening in the ducts. Alright, so if you look at this duct, it all has one nice layer of cells. When things start to change, when the cells multiply, it becomes abnormal, there is a point where it is called ductal carcinoma in situ. This is when the cells are abnormal, it's precancerous. It hasn't breached this wall, it hasn't come out, it's still inside the duct. If you detect a lump at this stage and something is done, treatment is done, you're cured. At this stage, this is called stage 0, all right? When it starts to come out of the wall like this, it becomes absolute breast cancer, all right? So then that is different. So if we look at the stages of breast cancer, stage 0 is ductal carcinoma in situ, when it hasn't breached the wall. Finding a lesion at this point and having it treated, your survival rate is 100%. Stage 1, the lesion is small, less than 2 centimeter. It hasn't spread anywhere, hasn't gone to your lymph nodes. Getting treatment at this time, still very good. Survival is 98%. Stage 2, your lump is more than 2 centimeters but less than 5. It has gone to the lymph nodes but not too many, less than 4. Your survival is still very good, 93. Stage 3, more lymph nodes are involved. Survival drops a little to 72. Stage 4, when it has gone to other different places. Breast cancer usually spreads lung, liver, brain, bone. If it has gone to other places, look at how the survival drops. All right? So the important thing about breast cancer is if you pick it up early, stage 1, stage 2, your survival is very good. You live a normal life after that. So don't wait. If you have a nagging issue in your breast, see someone early. So why do we always keep talking about breast cancer? It's because it's so common. It's the commonest cancer among women in the world and also in our country. So the lifetime incidence is 1 in 20. 1 in every 20 women has a lifetime risk of developing breast cancer. It's quite scary, right? And recently, the numbers of breast cancer seems to be moving earlier and earlier. Younger and younger women seem to be getting breast cancer. So what are the causes of breast cancer? We don't actually know the exact cause. We don't actually know. All right? But most likely, it is caused by changes to our genetic material. And this is because of lifestyle changes, living an unhealthy life, not exercising, not eating healthily. So all this will change your genetic material and leads to cancer. So I'm just going to go through the risk factors for breast cancer. 1, being a woman is already a risk factor. Sadly. Men can get breast cancer about 1%, but when men get breast cancer, it's usually more aggressive and very fast. Age. The older you get, the higher your risk of developing breast cancer. Of course, genetic factors. If there are family history of breast cancer, then your risk is higher. But one thing you must remember, of the patients that come in with breast cancer, 80% of them don't have family history. Alright? So, if you feel that you don't have family history, it's unlikely for me to get breast cancer, that's wrong. Not having children or having them later in life, after 30, is a risk factor. Having more menstrual cycles in your lifetime, like how Dr. Lee was talking about earlier, it is the nuisance, but it's also a risk factor. Not breastfeeding. So studies have shown that if you breastfeed, it reduces your risk of breast cancer. It doesn't mean that if you breastfeed, you will never get breast cancer, but it reduces your risk. So, the other thing would be low physical activity. If you are someone who is very sedate, doesn't do any exercise, that is a risk factor. Obesity is a risk factor, and also alcohol. These are all proven risk factors for breast cancer. So how can you lower your risk? You know all the risks. How can you lower it? You maintain a healthy weight. You be physically active. You limit your alcohol use, and you try and breastfeed when you're pregnant. All right, I think being healthy, watching your weight, eating well is something that people tell you about every disease now, right? Because every disease is very related to how our lifestyle is. We must lead a healthy lifestyle. If not, you get all sorts of things. Am I right? So, again, breast cancer is one of the most curable cancers. Because if you detect it early and you treat it accordingly, you can be cured. Early detection is your best protection. Because I'm going to repeat myself again, if it's found early and treated early, your survival is above 90. So this is statistics of patients in our country. If you can see, still 40% come in at stage 3 and stage 4. Why? Why do women in our country come in late? They come in with huge masses. Why do they do that? One, the stigma of cancer, being embarrassed about it, that's one of it. In our country, the belief in alternative therapy is very strong. Before they come and see the doctor, they would have gone to the BOMO, they have gone to the Sinsei, they have gone to everybody else, tried Ayurvedic medication, everything, before coming to you. And at the point that they come, it is yes. All right? And decision making. In some families, the women don't make the decisions. They wait for their husbands, they wait for the family. So there are a lot of delay in that issue before they come and see the doctors. All right? And they believe in myths. So what are these myths? That cancer equals to death. That's wrong. If you have breast cancer, you will not die if you come in early. All right? No pain. I have a lump, is not painful, so it cannot be cancer. You most likely, painless breast lumps are the dangerous ones. All right? When you tell me you have pain, I'm not so worried. Cancer only happens in old people. That's a myth. If you are young, if you find a lump, you must still come. The other myth is if I'm diagnosed with breast cancer, I'm going to lose my breast. I mean, that's the greatest fear, right? You don't want to lose your breast. But if you come in early and the lump is small, you just remove the lump. Don't you lose your breast at all. Right? Okay. So this is a picture of someone who came in 6 months after she first felt her lump. And look at it. The entire breast is occupied by the lesion already. This one. This is her lymph nodes which has ulcerated out. You would think somebody like this probably lives far away, no access to an hospital. But no, she was a university lecturer. All right? It's just that the fear, the stigma, she never came. This patient came to us fungating, smelly, with maggots coming out of her breast. So we still get things like this up to this time and age. This breast has already self-amputated. So, what encompasses breast cancer treatment? Surgery, chemotherapy, radiotherapy, hormonal therapy, targeted therapy. So many things, right? But not everybody will need all of them. All right? Some people will just need surgery, some just surgery and radiotherapy, some will need everything. It depends. Every individual is different. The treatment is tailored according to how early you come, the type of breast cancer you have, the age, and a few other biological features of the cancer. So I'll just talk to you a little bit about breast cancer surgery. So the most common would be a mastectomy, meaning the removal of the breast. So this is done when the lump is big, or you have more than one lumps in your breast. Then you would need a mastectomy where we remove the entire breast. While doing that, we will remove the lymph nodes, because like I said, the lymph nodes under the arm is the first place that breast cancer travels to. So it's done in the same surgery, same setting. So you'll have a straight line scar, your breast is gone. You'll have one line across your chest like that. All right? Next, a wide local excision. When is this done? When your lump is small. So when your lump is small, you do not have to lose your breast. We remove the lump with some margin of normal tissue around the lump. So this patient, she had a lump here at the side of her breast. So after removal, she has a scar at the side, but from the front you can't see the difference, right? Next patient, she had a lump here at the lower part of her breast. So we just remove the lump and also the lymph nodes under the arm. So from the front, no difference. This one, the lump was somewhere here. We made the incision around her nipple so we can hide the incision. And this is a line here that removes the lymph nodes as well. This patient had a tumor just behind her nipple. So we remove that area, we bring the skin up and make a new nipple for her. So we told her, okay, auntie, we can tattoo your nipple later. She said, oh, no, I'm very happy with this. So just like this, right? Okay, so if at all you need to have a mastectomy and you have to remove your breast, there are options where you reconstruct your breast at the same setting. Right? So you take tissue from the side, behind your back, take tissue from your tummy, so you get a tummy tuck, or you use an implant. All right? So I show you a few photos. So this is a patient who had a few breast lumps on here, so she had to have a mastectomy. We used the tissue from her tummy area, so you can see here she's got a tummy tuck and a nice shape of the breast which equalizes to the other side. This one, tumor in the center, so we couldn't save the nipple, but all of the breast has been removed. This is not her real breast tissue. All this tissue here is fat from her abdomen. All right, so her abdomen here is taut. This patient, she had a lump that was far away from the nipple, so we could keep her nipple. So it's just the nipple, the skin of the breast, the rest of it underneath is fat from the abdomen. Another patient, she had a very pendulous breast. So when we removed the breast, one side and put in the fat from the abdomen, one side was smaller. So we had to equalize with the other side. So in the end, she had better looking perky breasts. All right, so the other treatment would, after surgery, if at all you do need, would be chemotherapy, which is an IV infusion that's given to you by the nurse. You come in, daycare, it's given, infused for about an hour or so, and then you go back home. It is done in 6 cycles, all right? Everybody is afraid of chemotherapy, right? You talk about chemotherapy, it's the fear of losing your hair, the vomiting, and all of the side effects that comes with it. But nobody talks about the good points of chemotherapy, right? It shrinks your tumor. It kills the cells that have already traveled elsewhere. These are very important points because it increases your rate of survival. It increases the rate of it reduces the rate of the cancer from coming back. All right, so it's very important. Radiotherapy. Not everybody needs it. most times if you are going to just remove the lump in your breast and you are going to keep your breast, then you must go for radiotherapy. It's very simple. You lie down on this bed and then you get shined by something like an X-ray. Okay, so it's shined for about 10 minutes. It is done 15 times or 20 times depending on the patient. So you come in Monday to Friday, lie down 10 minutes and go home. So that's radiotherapy. And nowadays we have something called intraoperative radiotherapy. So if you don't want to come 15 times to the hospital and get shined, when the lump is removed during surgery, small lump, we use intraoperative radiotherapy. We put radioactive material within the breast tissue. Radiation is taken place at that time for about 20 minutes, and then we close up. So your surgery is done, your radiation is also done. Targeted therapy, this is not chemotherapy, is based on the biology of your cells. So not all people will require it. And then there's hormonal therapy. Like breast cancer has got a few things, few receptors, hormonal receptors. If estrogen receptor, progesterone receptor, if they're present in your breast tissue, it's good. And you can then use hormonal therapy. This reduces your recurrence rate. So there are a lot of treatment for breast cancer tailored individually for different patients. So pay attention to your breasts. Let them be your assets, not the death of you. So my take-home message is breast cancer is one of the most curable cancers if detected early. So please examine yourselves every month. Be breast aware. All right? Early detection saves lives. Thank you. Any questions? Oh, sorry. Okay, never mind.
Thank you, Dr. Daphne. Ladies and gentlemen, we will now proceed to the Q&A session. Please give us a moment as we set the stage. If you have a question for our guest speakers, please raise your hand and my colleagues will pass you a mic. Please only speak when you have a mic. State your name and where you are from, and we would like to encourage you to keep it to one question per person, please. Any questions?
Hi, my question is for Dr. Lee. So my name is Camelia. So I would like to ask, is it normal to not have menstrual cycle for 3 years or 4 years after birth, after giving birth?
Depends whether you are breastfeeding or not. If you have to
breastfeeding 3 years and 4 months.
Yeah, if you are breastfeeding, it sometimes can be perfectly normal. So if you are breastfeeding, but if you stop breastfeeding and you still don't have menses, by definition, anything more than 6 months, no menses is considered abnormal.
So after I stop
breastfeeding, yes.
Breastfeeding, so I should
resume your menses
after 6 months.
by 6 months.
More than that is not normal.
Not normal. So by definition, this is called secondary amenorrhea.
I see.
6 months.
All right. Okay.
Any more? Feel free to ask.
That's why breastfeeding has its benefits. If you continue to breastfeed and you have absence of menses, it's actually very good.
We do have time for a few more questions, so if you have any, please do raise your hands. Lady at the back, yoga.
Hello, Dr. Daphne. You said to do the mammogram every 2 years.
Yes.
But what about some people who go out and do it every year just because they are afraid? Is there any danger to doing the mammogram yearly?
There is no danger of doing it yearly because if, let's say for our patients who have breast cancer and they've already been treated, we do their surveillance yearly. So there's no issue with doing it yearly. But if you don't have any symptoms, then there's really no point in doing it yearly. Once every 2 years is fine.
Thank you.
Next question. Over here.
Good morning, Doctor. My question is to Dr. Daphne.
Yes.
Doctor, normally when they say family history, when you have a family history of cancer, your chances of getting cancer increases. For breast cancer, let's say if mother or immediate family member has a breast cancer, your chances increase. How about if let's say they have different type of cancer? Does that mean that the person has a high risk of cancer?
Usually for breast cancer, we look at breast cancer itself, your family history of breast cancer. If you've got colonic cancer and other cancer, is not related.
Okay. Okay, thank you.
Yes.
Any more? You can ask here for free. If you see them in the hospital, it's a different story. Okay.
Actually, just now, Daphne mentioned about late menopause being a risk factor. So therefore, I think some women, when they are 55, 56, even 57, they are still menstruating. And I always tell my patient, I don't like it. So if you are still menstruating at that age, then you run the high risk of breast and uterine cancer. So if you're still menstruating at 55, 56, please, you have to actually get assessed and may even require an endometrial biopsy to make sure there's no precancerous change. And a mammogram, yeah? Yeah, they think, wow, I still got hormones, so I still can look young, things like that. But at 55, 56, no. Something wrong.
Sorry, can we hand you the mic first to ensure everyone can hear your question?
Meaning if you have menopause earlier, it's better? No.
See, the average age of Malaysian women menopause, anybody know how old? From the
50,
survey?
50, 55?
49 point something lah. So you're talking about 50. So again, it's a bell curve. If you look at the statistics, it's a bell curve. So you're talking about 50. So some people will still get 1-2 years earlier. Some people get a few years later. So then the bell curve, at the extreme, it will be outlier, isn't it? Yes. So you're talking about premature menopause, early menopause, you're talking about 45, below 45. So those are at the other extreme. When you hit 55, then you are the outlier already. Anything at the extreme end, you know it's actually not very good.
So, meaning if you're 50 and you menopause, you should very happy.
50, 50, yeah, 50, 51, 52. I mean, that's a...
Yeah, because some people feel like menopause is something like, there's stigma. If you menopause,
grow old.
Something like that.
Yeah, I always say aging is inevitable.
Yes.
So people are trying to sell you all the secret formula for anti-aging. They are all making money from you.
Yeah.
Lifestyle is still the best anti-aging.
Okay, thank you, Dr. Lee.
Lady at the back has another question. Yeah.
Dr. Lee, for those people who have to go for pap smear, do they have to go yearly or every 2 years?
That's a good question. Now we are using liquid-based cytology. If you look at the recommendation, if you do a liquid-based, it's every 3 years. But plus, if you do a HPV as well, in fact, it can go up to every 5 years. Each your pap smear, thin prep, liquid-based is normal, and your HPV negative. So in fact, up to 5 years. You must understand that nowadays, the thin prep, compared to another test which is more accurate, which is looking for the virus. If you don't have a virus, your risk of cervical cancer is actually very low. Almost like, you don't have virus, because 99.9% of the cancer is due to the virus, HPV. Now, if you do a yearly, again, difficult to say that, you don't have to every 3 to 5 years, but if you don't have the HPV virus test, then the 3 to 5 years may end up in problem. Because if you have the HPV virus, the recommendation is yearly. So, to answer your question, I cannot say no, I cannot say yes. But for me, if you don't want to do the HPV, I would say you try to do 3 consecutive smear yearly. If 3 are normal, then less likely that the next few years you're going to end up with precancer. You must understand that the pap smear are not accurate. It is so operator dependent. Depends on the person who's doing it, the cooperation of the patient, and the cytologist, the lab fellow. By the time he's looking at the number 20th slide, his eyes, and you are the 21. So it's so operator dependent and the patient dependent. So for me, if I say, wow, hey, you've been done so many, pap smear yearly come, skip 2-3 years, it's fine. But now the recommendation is if you're above 30 years old, in US, no question asked, they will screen Tim Prep plus HPV. But in Malaysia, HPV is expensive, additional about $250 to $300. But if you do it, if you're older, women 40, 50, both negative, in fact, you don't have to do for 3 years. So in fact, actually, it saves money. The initial sum is expensive, but if the HPV is positive, then that's different. You may even need to do it every 6 months or even yearly. Because you got the virus, slowly it may start causing some changes. So you want to pick it early. So can't answer direct, but it depends on circumstances. So.
Doctor, may I have another question, Dr. Lee? I encountered a doctor, a GP, who said even if you are sexually not active for the past 10 years, you should still do at least another 1 or 2 pap smears.
Yes, correct. Because the cervical cancer is due to the virus. You may have got the virus infection long time ago. It's still sitting there waiting to cause trouble. That's all only. Because it's not now. Because previously you may have already got infected.
The incubation period can last as long as 10 years before it's...
Or longer than that. Once you get the virus, the changes can occur for 10 to 15 years later.
Here. Good morning, Doctor. I'm Lily from KL. I just want to know, when we do a mammogram, the report will show that there is ACR 60 to 6. What is your advice and interpretation?
Say again, stage what?
ACR stage 0 to 6.
Must be BIRADS, I think. So it is just a staging, a scoring system that they use when they look at a mammogram. There's something called BIRADS, BIRADS. So there's 0 to 6. 1, 2, normal mammogram. 3, in the middle, need to do more regular screening. 4, suspicious. 5, almost surely cancerous. So there are different grades because they look at the things that they see on the mammogram, and for them to, there are a few points that they look at. So they just classify it such. So when we look at it, we see the number. The higher the number, not good. Lower the number, better. 0 is not good as well because 0 means the mammogram is not done properly, cannot be read.
Dr. Daphne, is it common to have a cyst on the same breast, say after 7-8 years? Do you have another one?
Breast cyst is very common.
On the same breast?
On the same breast. I think half of us will be walking around with a breast cyst. Okay, it's very common. It happens because of the hormonal changes in the body. The breast tissue reacts in such a way that it produces a cyst. Most times, the cyst will tend to disappear after menopause, or it becomes smaller or shrinks. But there are some of us that will have multiple breast cysts, 7, 8 on one side. No issues. Breast cyst is not cancerous. It doesn't become cancer. It's just annoying. That's all.
Thank you.
Hi, Doctor. I'm Anne. Dr. Lee, I would like to ask regarding IUD. Is it safe to use IUD, and how long actually you can use IUD?
Yeah, okay, thanks. IUD, there are actually basically 2 types in the market. 5 years. Usually 5 years. There's one type that is 3 years, but I think 5 years. Most of us, we use 5 years. Now, IUD, there are 2 types. One is a copper IUCD. The other one is a hormone, which I mentioned, Mirena. The difference is that the copper one is cheaper, and it's a couple of $100, basically for 5 years, but they are purely for contraception, purely. Side effect of copper can cause more bleeding and pain. So if you already have heavy menses and period cramp, please, for heaven's sake, don't use this IUCD copper one because it's cheap. No, I don't use it if the woman already have heavy period, because it will make it worse. Then the other one is called Mirena. IUCD with hormone impregnated inside. Every day they release a small amount of hormone. Instead of taking it, they release it, so it's actually a local effect. It's more expensive, it costs about 1,000 plus, lasts for 5 years. This is fantastic because it releases hormone, so it makes the lining thin. Just like you don't want the grass to grow. You can either burn it, pour chemical, that's all. Burn means endometrial ablation, scrape, burn. If you don't want, you pour chemical every day, so your grass won't grow. Same principle. So every day they release hormone, lining is thin. For 5 years, it's used for contraception, but it's also licensed to be used for treatment of period pain and heavy period, not for contraception alone. It can be. So therefore, in other words, it can be used in women who don't require contraception. It can be used in even single women, virgin. They have period problem, they want to settle their period problem, we can insert for them. So these are the two differences. So for me, I think the Mirena is still the best. 20% of them have no period at all. And they reduce the flow by 90%. Only setback is that in 10 to 20% of women, they have irregular spotting, stain a bit, dragging on for weeks. Irregular, don't know period. But you just be patient a bit, hang on for a while. By 6 months to 1 year, you will settle down. And then if you are the 20-30%, no period at all, it's heaven.
Any more?
I have two questions for both doctors. So for Dr. Daphne, just a question: if a pregnant lady she has a lump, a 2 cm lump in her breast, would that affect breastfeeding later? And then for Dr. Lee, is there any reason for the productions of the bad hormone, the prostaglandin? Yeah, thanks.
Okay, so a breast lump in a pregnant lady, a normal lump? Not sure yet. So a breast lump in a pregnant lady must be investigated first. So she will need to go for an ultrasound. She will need to go for a biopsy if it looks suspicious, because breast cancer can also happen in pregnancy. All right? So if it is a normal lump, let's say a fibroadenoma, okay, that's the most common thing to happen. I mean, if it is about 2 centimeters and she's already pregnant, most times there is no issues. It may tend to get a bit bigger during pregnancy because your hormones are there, it feeds on it, so it may get a little bit bigger. Most times after delivery, it will shrink. Sometimes if it is very near the nipple, you will have a bit of discomfort, a bit of pain when you're breastfeeding. Otherwise, there are no issues. So you don't have to rush to do any surgery if it is a benign lump. You can wait until after delivery. But you must have it checked if there is a lump.
Yeah, regarding the prostaglandin, we don't know. Every woman, when they're having menses, the body produces prostaglandin. So there are two types. One is to constrict, one is to dilate. So somehow there's an imbalance. So until today, we don't know why, you know. So,
any more questions? No? Okay.
Hello,
Sorry.
Dr. Daphne. Good morning. Okay, my question is, if let's say a person wants to go for the breast reconstruction, what is the recovery period like?
The recovery period is about 2 weeks. It's almost the same as doing a mastectomy. The mastectomy patient will have a little bit of pain for about 5 days. So it's about the same. It's just that you have pain in more than one place, in your breast and also in the abdomen. But the recovery, if you are a healthy patient, no diabetes, no hypertension, recovery is about 10 days. Okay. 5 to 10 days.
5 to 10 days. And one more question, doctor. If let's say the person has gone through a mastectomy in one of the breasts, and after some period, she has implanted the doctor has implanted the silicone.
Okay.
Okay, and but still find both her breasts are not even.
Mm.
You see, so can she still go for her breast reconstruction?
Yes, she can. If the implant has already been done on the side that had the mastectomy and she's not happy with the way it looks like for cosmetic reasons, she can have what we call as fat filling. So we take fat from your thighs or from your tummy, and then we inject it in the area where you have the implant, just above it to maximize a bit on the shape of the breast, so we equalize it to the other side. So it's still able to be done. So you should probably see a plastic surgeon for that.
Okay, thank you, doctor.
Any more questions?
Hello, Dr. Lee and Dr. Daphne. Dr. Lee, you mentioned that late menopause is not so good, but early menopause will also bring other problems like heart problems or brittle bones. Could you explain on that? And also, my question for Dr. Daphne, science has improved so much, but why hasn't it helped ease the side effects for chemo patients? They are still suffering all these years that we hear all the side effects. And secondly, is breast calcification dangerous? Breast calcification.
Okay. Late menopause, early menopause, you're talking about below 45, whereby you don't have estrogen. Estrogen protects the heart and bone. Lack of estrogen will cause osteoporosis and then certain heart changes in your muscles, and for example. So that's quite easy to understand. Well, when you are late menopause, when you are 55, 56, and you're still bleeding, your body is being exposed to a high estrogen environment. Estrogen environment stimulate the uterus, the lining to grow. And at that age, you don't have ovulation. Your egg, they have been depleted. There's no ovulation. You don't have the progesterone to protect the endometrial layers. Therefore, the continuous stimulation, eventually you run the risk of that cellular changes that actually convert into cancerous growth. So therefore, the breast as well, some of those are breast estrogen receptor positive type, you don't want estrogen. That's why you take tamoxifen to block the estrogen on the breast if you have breast cancer and you are estrogen receptor positive. Therefore, prolonged exposure to estrogen no good. Just like if you take estrogen tablet now, also you run the risk of getting cancer of the breast and the uterus. So prolonged continuous exposure to estrogen is actually no good. That's why. So if you are talking about 50 something, you're still bleeding, there's something wrong. And sometimes there's one type of ovarian cancer that actually produces estrogen independently. And they are the one that cause postmenopausal bleeding sometimes. So that also is a form of ovarian cancer presenting as postmenopausal bleeding because they suddenly start producing estrogen on its own and then stimulate the period.
Okay, but the side effects of chemotherapy. I think chemotherapy is such a big thing, such a big industry with big pharmaceutical companies working on it. And a lot of research is still going on. And if you compare chemotherapy from before and now, there's so much of improvement. And also in the medication that is given to combat the side effects. I don't think you'll be able to completely have no side effects altogether at this point. Maybe in the future they'll be able to make such chemotherapy, but until then, what they do now is they give you quite good medication to combat the side effects. So people tend to respond or to accept chemo or tolerate it much better. Your other question on calcification, that's right. So calcification is seen on the mammogram. There are a few types of calcification. One is macro calcification, it means big white dots. The other one is micro, small dots. So big dots, we are not worried. Macro calcification is very normal, it happens with age. Then there is microcalcification. So that's the one that is a bit worrying. But if, let's say on your mammogram, you have these small little dots, but they are dispersed everywhere, here, everywhere, that's fine, that's normal. But if they are all clustered in one area, small little dots all in one area, that is suspicious of breast cancer. So these are the things, when you do a mammogram, they will look at those calcification and they will report it whether it is a benign calcification or not.
I think I agree with Daphne regarding the chemotherapy. I mean, when I was a medical student, when I was going through the training, the effect from chemotherapy is horrible. Really, not only the hair loss. Hair loss, I think, is still okay, but the vomiting, really terrible. But nowadays, very mild. Most patients, and I can tell you, it all depends on the mind. I have patients who had ovarian cancer going for chemo. She still runs nothing because her mind mentally very strong. So for her, nothing for her. So she's still active, work, run, exercise, no problem. So at the end of the day, nowadays, I think the chemo toxicity has actually reduced. There are drugs to actually help you feel better, anti-vomiting, but ultimately it's the patient whether they are actually able to accept it or not and work around it or and be strong mentally. I think these are helpful, but definitely chemo now, many patients definitely they say chemo, I need chemo, wow, like it's a death sentence, death sentence. So I say, what's wrong? Only for a few months, not that bad, So I think there's a misconception about chemo.
Any more? No, okay. So with that, we have come to the end of today's Starlive session. Big round of applause to Dr. Daphne and Dr. Lee for taking the time to share with us. Ladies, the breast examination and some booths are still open next door, so if you'd like to do that, please head there. Don't forget to pass your survey forms to my colleagues as you exit. We hope to see you again at the next Starlive. Thank you and have a good weekend.